Take one.
Is it hard for you to say those words, we're trying to cure cancer?
That's a really good question, and why it's hard to say we want to cure cancer. We do. And I think sometimes it's hard actually to think that you might actually succeed.
Patients that we're treating on this clinical trial have absolutely no other options left for them. These are patients who are unfortunately destined to die of their disease, and in a fairly short amount of time.
Emily Whitehead, 554.
So Emma is incredibly matter-of-fact about all of this stuff. This was a child who had had her leukemia come back twice. The parents were looking for a miracle.
What we've learned how to do is train the immune system to recognize and then kill tumor cells.
It's a procedure where we collect their T cells, and they are infected with a virus that will genetically change them so that they will now see and react against their leukemia cells.
And we actually use the HIV virus to do that.
So you're taking the HIV virus and infecting healthy cells with it to help kill cancer?
Yes. The virus has been engineered so that it can't cause disease anymore. But it still retains the ability to reprogram the immune system so that it will now attack cancer cells. We call those modified immune cells serial killer cells. Each infused cell can kill more than 1,000 different tumor cells.
But the reality is the dramatic responses of cancer to new treatments are very unusual. We need to make it clear when we talk to a family that it may not work. Emma was given her T-cell treatment, and within a few days, she was very sick. She had breathing difficulties, she had blood pressure difficulties. We knew that she could not have gotten any sicker without actually dying.
But then a remarkable thing happened. The T cells were growing, they were starting to fight the cancer.
Within hours, Emma's fever disappeared.
It was like the calm after the storm. The clouds went away, and she woke up, and there was no leukemia. When that child survived, it was, of course, an amazing event.
First of all, I would say that this whole technology, which has been innovated here in Philadelphia over the last number of decades, truly is not only transformative, I think it's essentially miraculous.
The nirvana in research was curing cancer. I mean, that was a cliche when I was a little boy. And here we are at the doorstep of finding a cure for cancer.
We're finding the keys, and there's always a reason to be hopeful. I was literally told I had about 2 years.
Normally, the job of the immune system is to attack foreign substances like bacteria or viruses. But Dr. June's team has been able to engineer the body's own immune system to go after cancer cells as though they're foreign agents.
To make a new cancer therapy, what we did was program T cells So the cells that are infected by HIV viruses and so on, we program those to become like antibody-based B cells. Those cells then became, after this reprogramming, leukemia-specific killers.
So what Carl's done in his team is to be able to engineer homing devices, molecular homing devices on the surface of your immune cells so they can search out just like a key looking for a lock.
Since it was dealing with altering genetic material, it was like a first taste of a brand new area of medicine. And that alone was intriguing. But I think the thing that made us all sit up and pay attention was these were patients who had tried everything else and had been through everything else, had really no hope, and yet were cured in about 3 weeks.
The third patient we treated was published in the New England Journal of Medicine in 2011. Douglas Olson, who's a scientist and had leukemia for over a decade, and treated here at the University of Pennsylvania by David Porter.
I was diagnosed with cancer in 1996. I was 49 at the time. It was CLL, or chronic lymphocytic leukemia. The prognosis at that point was that the survival rate was somewhere around 6 to 15 years from diagnosis, and there was no cure at that time other than a bone marrow transplant.
Most people can't get a bone marrow transplant, and if they do, a lot of times they have lifelong problems with complications. So I began working on a therapy, doing basic immunology to learn how to grow the T cells. But those T cells come from a donor, someone else. And in our case, we're trying to do it where the patient themselves is a donor.
I really saw it as a way to fight back, frankly, that I wasn't going to be continuing to be a victim of this thing.
They withdraw cells from the patient's bloodstream. They engineer these cells in the laboratory and then reinfuse the cells so that they can attack the cancer as serial killers. And then once the cancer is destroyed, they stay around as sort of a vaccine, should it come back. So it's designing an immune system to treat cancer.
About a week later, I was in David's office, Dr. Porter's office, and we were sitting there and he's looking at me. He said, "Doug, we can't find a cancer cell anywhere in your body." He said, "Your bone marrow is completely clean."
As the immune system eradicated his tumor, he had pounds, literally pounds of tumor, and it went away in less than a week. It was an astonishing event that we saw.
It was at that point I knew that I was going to be okay. It was just, Dr. Porter was just standing there beaming. And
what he said when that happened, when Dr. Porter gave him that news, is he got in the car with his wife and went down to Annapolis and bought a boat.
Medical research doesn't happen overnight. It takes a lot of hard work, and the evolution of Dr. June's work has been a multi-decade process that now is coming to fruition.
Certainly there's been a lot of investment in gene therapy, and as you've seen, things come and go. But in this case, it just happened that everything lined up correctly.
The first child treated, her case was featured on the front page of the New York Times. She had incurable leukemia and multiple relapses, and we gave her just the CAR T cells, and over the period of 17 days it eradicated pounds of tumor in her case, as well as we'd seen in the adults, and the leukemia was gone. And she's now past 1-year anniversary. I think the public has for a long time wanted cancer to be cured, and so have the scientists. The problem has been that it was a lot more complex than we knew.
I look at this whole thing as a pivotal moment in medicine, really in the history of medicine. If you look at in cancer therapy, we've had surgery, you can remove the cancer. You have radiation that radiates and basically burn the tumors. Or you have chemotherapy that not very specific, kills the cancer cells off in a very toxic way. Well, this is a whole new ball game, which is exploring your immune system, engineering your immune cells to go after the cancer cells, almost a whole new angle on therapy. So it is a game changer. And the fact that it works in a series of diseases now gives us great hope that we can apply it to other diseases and really change the game of how we're dealing with cancer in the future.
Thai scientists led by Professor Dr. Pichet Wiriyachitra have unveiled their significant breakthrough this week, proving that concentrated extracts from mangosteen contain anti-cancer properties. And Kun Orapha Chorprasit has the details for us.
Mangosteens have been cultivated and used as an effective traditional medicine in Thailand for centuries. In 1978, Thai scientific studies showed that mangosteen's rinds helped boost the body's immune system, as well as helping the body fight off viral and bacterial infections. After 35 years of research, Dr. Pichet, chairman and chief executive of Asian Phytoceuticals, disclosed during a press conference on Monday that the beneficial effects of the fruit are due to the substance known as GM1. Doses of GM1 have been proven to be capable of balancing the body's immune system and in turn making it stronger against pain, fever, inflammation, diarrhea, infection, ulcer, and cancer. In 2008, Dr. Pichet led a scientific team at the Mangosteen Research and Development Center, Thailand, to conduct Operation BIM. As a result, the new BIM formula has been prepared using extracts of 5 kinds of Thai fruit and grains claimed to have helped boost the activation of T helper cells, which play an important role in establishing and maximizing the capabilities of the immune system. The company has since been marketing the extracts as part of dietary supplements for cancer patients, as registered with the Food and Drug Administration.
What we have done today is to announce our discovery to the public that the formulation we developed from mangosteen active ingredient, which we call GM1, admixed with ingredient from various other herbs in Thailand, has the ability to increase the amount of T helper cell 17. Now this T helper 17 has been the landmark of many scientists around the world in trying to clone and produce in a large quantity and introduce it into cancer patients in order to prevent and cure cancer.
Experiments conducted with volunteers have conclusively proven that the patented BIM product significantly increases cancer patients' life expectancy and improves their quality of life. Tests carried out in laboratory and on test subjects in Thailand, as well as in partnering countries such as the US and Italy, have yielded satisfactory results.
What we have shown today is that the quality of life of people under this program has improved greatly. Together with what is going on in Thailand, our colleagues from Italy and also from United States has found the same effect. So the 3 studies have conclusively supporting each other that the quality of life of people who are suffering from cancer definitely is improved, and in some cases, the life expectancy has been increased significantly.
This is Orapha Chorprasit reporting.
TS17 Global, providing national cancer care through Operation BEAM or Operation Balancing Immunity. It all started in the year 1978 when a group of Thai scientists started working on the skin of mangosteen. And from it, they isolated a series of xanthones, one of which is labeled GM1, which has 4A activities, A1 being antibacterial, A2 anti-inflammatory, A3 antioxidant, and A4 anti-cancer. In the year 2007, we announced that the health benefit from mangosteen is mainly from balancing immunity, not antioxidant activity as widely publicized. We then formed an Operation BEAM research team consisting of various disciplines of scientists, together with the #1 immunologist in Thailand, Dr. Vachara from Chiang Mai University, in order to investigate the immunological mode of action of BEAM products under the supervision of Dr. Vachara. We learn and confirm that white blood cells are responsible for the balance of body immunity. In our body, there are 20 billion up to 55 billion of white blood cells, and these white blood cells communicate with each other all the time through interleukins in a chain reaction manners. These white blood cells are divided according to their function, that is, to their ability to tackle fungus, bacteria, virus, and cancer cells, and through its ability to build up antibody to tackle antigens, and finally, T helper cell, which sends signal through cytokine to white blood cell type 1 and type 2 when they are intruders of pathogens. The T helper cells abbreviate TS cell in the body when it's stimulated by cancer cell, fungus, virus, and bacteria. TS cell will become TH1. This TH1 secretes interferon gamma in TNF alpha, which stimulates the killer cell, increase its ability to tackle cancer cell, virus, fungus, and bacteria. This is the body self-defense of TH1. When there is excessive TH1, autoimmunity will result. For instance, multiple sclerosis, scleroma, and diabetes type 1. So in the body, there should be a balance of TH cell, not too much and not too little. TH cell can become when activated by antigen and parasite, TH2. This TH2 then secrete a series of interleukins, interleukin 4, 5, 10, and 13, which stimulate the bone marrow to build up eosinophil, which is a white blood cell, in order to tackle the antigen and parasite. However, when there is excessive TH2, allergy arises, so is autoimmunity, which is a wide range of ailments in the body. For instance, arthritis, osteoporosis, oral disease, liver infection, thyroid disease, including leukemia, atherosclerosis, asthma, psoriasis, uterus inflammation, and disrupted sleep, etc., etc. In other words, there are a long series of symptoms arising from autoimmunity. Most people don't know that all these symptoms are coming from the same cause, that is from autoimmunity. So when you have 4 or 5 sets of symptoms, you take 4 or 5 sets of capsule or tablet. which eventually damage your liver and kidney. Knowing that all of them coming from the same cause, all you have to do now is reduce the common cause, that is, the reduce Th2. TH cell could also become Th17, which is a new cell just discovered by scientists in the year 2008. This Th17 secretes interleukin 17 and 22, which stimulate other white blood cells in the body in order to increase the ability to tackle pathogen, fungus, bacteria, virus, and cancer. So all these pathogens will be eliminated from Th17 activities. However, again, when Th17 become excessive, we get severe conditions of inflammation and autoimmunity, such as psoriasis, diabetes type 1, inflamed intestine, and arthritis. T cells could become T regulator, which secrete interleukin 9 and 10 in order to regulate too high Th1, Th2, Th17. As a result, it will remedy all autoimmune symptoms arising from too excessive Th1, Th2, and Th17. However, again, when T regulator become excessive, immunity from Th1, Th17 will be lower. If you happen to try to kill cancer, cancer cell can then escape from the elimination. Now, all it's about to is that the balance of immunity depends on the balance among Th1, Th2, Th17, and Treg. The Th17 regimen consists of Th balanced mangosteen juice and Th17 capsule. The Th balanced mangosteen juice is made to be delicious without any sugar added. There's no artificial color added, no artificial flavor added, and no preservative. Most importantly, there's no rime material which may have residual insecticide and liver toxic content of dark brown tannins. As we know that the large intake of tannins may cause bowel irritation, kidney irritation, liver damage, irritation of the stomach, and gastrointestinal pain. There has been a correlation between the esophageal or nasal cancer in human and regular consumption of certain herbs with high tannin concentration. So this skin should not be consumed over a long period of time. We get volunteers to drink the Th balance juice for 15 days, each day taking 300 milliliters, and see what happened to the T helper cells. Now this is what happened. Th1, Th2 is affected. As a result, Th1 dominates Th2. Th1 is slightly decreased, but Th2 is markedly decreased. So Th1 dominates Th2. As a result of this, the allergy and autoimmunity will be reduced. Th17 decreased. Autoimmunity will become less severe, but the ability to eliminate pathogen is also reduced. T regulator here increases. So allergy and autoimmunity are reduced by drinking this Th17 balanced mangosteen juice. So Th17 balanced juice decrease or reduce all kinds of autoimmunity by regulating excessive Th1, Th2, and Th17. However, Th balanced juice also decreases Th17. So the ability to eliminate cancer cell will be somewhat reduced as well. However, this Th balanced juice contains alpha hydroxy acid, which can chelate free iron that promote the growth of cancer cell. It also contains hydroxycitric acid, which trap the enzyme used in the synthesis of fat that is a part of the cell wall lining. It contains the standardized content of GM1, which kills cancer cell upon impact. In addition, it has a high content of polysaccharide, which inhibit the spread of cancer cell. Therefore, the TH balance juice is used to slow down the growth of cancer cell in the pathway that is different from balancing immunity. The TH17 capsule is made from a synergistic mixture of refined extract from mangosteen, sesame, soy, centella, and guava. We get volunteer to take 2 capsules before breakfast and 2 capsules before bedtime for 15 days, and to see what happened to their TH cell and T regulatory cells. And this is what happened. The green bar representing the blood sample of the volunteer who took TH17 capsule, and the yellow bar representing the blood sample of the volunteer who took placebo capsule. This is a cornflower. Now, TH1, TH2, TH17, Treg. You see that all the TH cells and Treg are affected. Now, TH1 increases. Now, the ability to eliminate fungus, bacteria, virus, and cancer cell is therefore improved. TH2 decreases insignificantly. However, the overall picture is that TH1 dominates TH2. Therefore, the allergy and autoimmunity will be reduced by the TH1 domination. TH17 increases markedly, in fact by 5-fold. So the ability to eliminate the pathogen is improved significantly. T regulator increases, therefore allergy and autoimmunity resulted from excessive TH1, TH2, and TH17 are reduced. TH17 capsule, 4 capsules a day increase TH17 by 5 times and TH1 cell by 2 times, naturally, just by taking the capsule, without any side effect. So for cancer treatment, every day we use 3 TH17 capsules before lunch, dinner, bedtime, in order to promote TH1 and TH17 to better eliminate cancer cell. And then 300 milliliters of TH balance juice in the morning in order to increase T regulator to regulate the body immunity. With this practice, the immunity is not only balanced but also dynamic. Now, Operation BEAM scientists believe that the dynamic balanced immunity is the key to the effective elimination of cancer cells. The regimen is recommended for cancer patients with autoimmune symptoms. In Thailand, a clinical study was conducted at the Faculty of Medicine, Chiang Mai University by Professor Dr. Sumitra Thongprasert. In these studies, the result is that terminal stage lung cancer patients who did not respond to chemotherapy and radiotherapy improved their quality of life and live longer than expected. In Italy and USA, where terminal stage cancer patients, including a pancreatic cancer patient who did not respond to chemotherapy and radiotherapy, improved their quality of life and live longer than expected. At this point in time, we conclude that TS17 regimen add life to time, add time to life, and creating new life for cancer patients. The TS17 regimen has been helping people who are suffering from end-stage cancer in Thailand for the past 5 years, since the year 2008. Mr. Wong Woi Sui from Malaysia came to Thailand for the regimen. He had cancer in the nasopharynx in 1994 and had an operation, but no improvement. He suffered from flu and pain over the whole body. 2 years later, his CEA, which is the cancer index, went up to 50 nanogram per ml. He went to Singapore for treatment. CEA went down to 1.5 when he was in hospital, but went up again when he came out of the hospital 2 months later. The cancer then spread to bones, spinal cord, and after all the treatments, CEA did not drop and stay at 18 nanogram per ml. This is what he said to me. All kind of supplement never helped me. I was introduced to TH Balance Mangosteen Juice, which was sold in Singapore. The flu and pain symptoms disappear at a very short time. And all other mangosteen never give me any improvement. TS17 product is different. He came to see me in Bangkok to find out how he got better. I then got him to start taking 6 TS17 capsules per day, together with 2 bottles of TH Balance Juice. 2 months after, the CEA went down to 3.8. The PET scan showed that there was no cancer left in the whole body, but the doctor could not believe it and advised him for a follow-up checkup in 2 months' time. And this is what happened. CEA dropped to 1.9 in 2 months after, and then 1.2 nanogram per ml 4 months after. Mr. Wong has continued using the regimen and remained in good health for over 4 years now. For colon cancer, this lady suffered from 3rd stage colon cancer. She was treated with chemotherapy but could not tolerate the side effect. TS17 capsules were used to reduce the side effect. She then can continue the chemotherapy until the course was completed. So she was cured from cancer after the treatment. Bunma had terminal stage lung cancer. He was treated with chemotherapy twice, 2 sets of chemotherapy without any effect, but there is a lot of serious side effect. He was given 3 days to live by the doctor in his village before he came to the treatment. The quality of life improved markedly after taking the regimen. Then he came to give an interview in our press conference 6 months after. He now had lived happily in the past 15 months. This gentleman here had terminal stage prostate cancer. He was paralyzed from his waist down. After being treated with radiotherapy without any result, the cancer spread to the lymph node and into his bone and destroyed his bone, and eventually the bone suppressed on the nerve. So he could hardly move from his waist down. After taking the regimen, the quality of life improved markedly. And 10 months after, he can come and give the interview in our press conference on the 6th of August. When he started using the regimen, his PSA was 100 nanogram per ml. It was reduced to 31.88 3 months after, then 1.86 5 months after, then 0.82 8 months after. Mr. Sutev has been living happily for the past 15 months now. There are lots of people in Thailand who benefited from regimen. And these are the people who are kind enough to come and give an interview in order to encourage other patients. These people who have improved their quality of life by TH17 give their detail, which can be viewed back from www.bin100.com. These are the people who have recovered from cancer, most of them the end stage, who were kind enough to come to give interview in order to encourage other patients to use the regimen. Nowadays, every week we have people come into office and thank us for helping to improve their quality of life from cancer suffering. TH17 Global, providing natural cancer care. The effects of TH balance juice has TH1 dominates TH2, lower TH17, and also increase T regulator. So the juice has been benefited from people who suffer from gut, allergy, autoimmunity, osteoporosis, oral diseases, liver infection, thyroid disease, including leukemia, atherosclerosis, asthma, psoriasis, uterus inflammation, disrupted sleep, skin rash, multiple sclerosis, and scleroderma, etc. and etc. The direction for use is half to 1 sachet a day. TH17 capsules increase TH1, resulting in TH1 dominating TH2. It increases TH17 and it increases T regulator. So it could benefit people who are suffering from allergy, inflammation, gut, peptic ulcer, vertigo, fungal and bacterial infections, viral infections, cysts, and tumors. The direction for use is 1 to 2 capsules before meals or before bedtime. Total of 2 to 4 capsules a day.